to be here all together. Just want to take a second and ask you, did you know that you have a superpower, a hidden superpower? And you brought it with you here this morning. And it's all around us. And you can choose to tap into it at any point. Would you like to hear more? Yes. So I'm a physician, and I know when most people think about health, they think about diet, exercise, sleep, the occasional trip to the doctor, maybe the genes that they inherited from their parents. But there's an often overlooked and essential part of health that is kindness. And I just want to, because I'm giving a talk on kindness, address the elephant in the room. And that's that I am human. You all are human too. Nobody is kind all the time. There's not kind people and unkind people. We all have our moments. And I will tell you, on my road to Wahasu, I had one of my own moments. I snapped at my children while preparing a talk about kindness. I'm human. So I approach this conversation with humility and as a learner myself. So with that, we'll go ahead and get started on how we can activate this superpower that we all have. I'm going to take you on a tour of public health over the next 18 minutes. And we're going to cover a lot of ground. And I ask that you listen for things that inspire you. If you like, jot them down. And also listen for things that might inspire a friend or family member, and think about what you might want to teach them from this talk as well. Does that sound good? So for those of you that are concerned that kindness is a fluffy subject, I'm just going to go ahead and start with talking about rabbits. This is actually a picture of my son and a family pet, Luna. So there was this study that was done back in the late 1970s by a lovely man named Dr. Robert Neeram. He was interested, he's a basic science researcher, and he was interested in studying diet and heart health. And so what he did is he gave these virtually genetically identical rabbits all the same high-fat diet. And what he expected to find is that all of the rabbits would have the same health outcome. And when they went to look at the results, what they found was that one group of rabbits had vastly different outcomes than all the other rabbits. Because of that, he thought there was something wrong with the protocol. So he, as any diligent researcher would, checked everything. Everything checked out. Then, because of that, they started to look around and notice that all of the rabbits that did better, and we're talking like 60% better health outcomes than the other rabbits, were under the care of the same researcher. And they noticed that this researcher wasn't just feeding the rabbits. She was petting the rabbits. She was talking to the rabbits. She was picking up the rabbits, holding them. She was basically giving them love and kindness. And this study was remarkable because Dr. Neeram at the time thought, how could this be? How could it be that somehow the way we're treated is changing biology. This is not how we understand biology works. And so much to his credit, he thought, we'll go ahead and repeat the experiment, this time with tightly controlled conditions. And in fact, they got the exact same results. And they published it in the journal Science. Now, as a physician, this study is, again, not how we understood biology works at all. And it really was the beginning of decades of research that showed that our social world gets under our skin, and how we're treated deeply matters to our health, and how we're treated actually in all the everyday interactions of our lives. And what this means is how we're treated and how we treat others in our homes, in our workplaces, in our friendships, in our schools, in our broader communities, in our neighborhoods, and in society. This is what we call in public health the social determinants of health. And this is what the rest of us in everyday terminology call kindness. So how do we define kindness? So researchers define kindness as an act of generosity, expecting nothing in return. But here's the irony. I don't need to tell all of you. I mean, every single person in this room has experienced kindness, has given kindness. And actually, I'd love for everyone, just take a second. You can close your eyes if you want to. And just think about something kind that you either saw or did in the last week. And it can be something small. It could be, someone held a door for you, smiled, said hello, or something big. And now think about how you felt in that moment, either giving or receiving that kindness. And raise your hand if you felt one of the emotions you felt was something like valued, connected, seen, appreciated, or loved. Okay. I saw lots of hands go up. So this is it. Kindness creates that positive social connection that is so critical for our lives. And this exactly gets at all of this data that shows, in fact, kindness is profoundly important for our health. And there are all these different studies showing, kindness is beneficial and positive social connection, buffers stress, it lowers our blood pressure, it boosts our immune system, and it lowers feelings of depression, anxiety, isolation. And this is what's so incredible, because kindness is all around us all the time. It's just a question if we want to tap into it. So I'm going to take you on a tour of some of the big areas that we can talk about when it comes to thinking about kindness and how it applies to our life. So first, let's take a second to think about the connection toolbox, because I think there was so much loneliness over the last and separation and isolation, just to sort of remember our skills. And this is where I think the data is particularly exciting, because it shows that every little bit of social connection helps. So even this morning, when we were chatting with people that we may or may not know, asking about their values that Sandro asked us to check in about, that was building positive social connection. So sometimes it's these deep relationships with family or friends that you've known a long time, and sometimes it's what we term social weak ties. Those are all critically important, and it involves everything from saying hello to the person you pass on the street, making eye contact, smiling, which I live in New York City. It's not always often done. Also, things like checking in with a neighbor. We're going to talk some more about that. But don't underestimate those little moments of just asking the barista, how's your day going? You can actually have some really amazing positive conversations, and studies show that this is all an important part of connection and kindness. Now, we know that where we live and play is critical to our health. And in fact, in America, your zip code is actually a better predictor of your health than your DNA. And that's what we call in the US, or in public health, ZNA. And we know that living in a neighborhood that is stressful and feels unkind and maybe has high crime has been shown to shorten telomeres, which are the little timekeepers on our DNA that are associated with lifespan. And we also know, conversely, that neighborhoods that are greened, that people feel a sense of connection and they feel safe, can boost health. And we also know things like greenery, and being here in Miami, I'm reminded of it, can do things like reduce depression rates and actually reduce depression prescriptions for medications, can reduce violence, and also help people boost people's immune systems. So when you have free moments here, please enjoy that lovely outside. And learning. Do we have any teachers in the room or educators? Woo! Okay. I also consider myself an educator. I teach the medical students, and my mom was a teacher as well. And so this is a mind-blowing statistic. So for every one life saved by biomedicine, education saves 8. So think about that. Woo! So educators are actually health workers. And so the teachers who raise their hand may not always realize that, but the work that you do is so vital for the students you teach. And it seems to have both direct and indirect consequences. And it's kind of mind-blowing. And the other thing that's really cool is this doesn't stop with formal education. It also includes lifelong learning. So exactly what we're doing here. So I also want to take a second to just thank Karen and the Wahasu team for continuing our education and helping us be healthier. And then Sandra just talked about this. So this ties very closely to education, and it's this idea that purpose, and this gets at the mind-body link. Now, for me as a physician, this was mind-blowing because I was seeing it a lot clinically. Patients who defied diagnoses, I didn't understand it, but oftentimes there behind it was a sense of purpose, and they had to get to something. They wanted to do something, and they felt driven to do something. And I think this is, I don't know if we have any other clinicians in the room or people who work in healthcare, but it's something that we'd often talked about but didn't understand. And it's just been in recent years that the research around this has really come through. And it's amazing because people with a strong sense of life purpose actually live longer, which is remarkable. And they're at lower risk of all causes of death and other adverse outcomes like heart disease, strokes, and also developing cognitive impairments like dementia. And so what's also great about being here is we're all cultivating that purpose. And then work. So we know that we spend a third of our lives working, and that how we are treated at work is critical to our health. And there are large population studies that show how you're treated in your workplace is a significant factor in your health outcomes. And sometimes it is the most significant factor in health outcomes, which is also quite shocking because I think everybody here probably thinks it's really important to have a good doctor. It turns out it's also important to have a good manager, a good boss, a supportive colleague. All those things matter. And I know we're going to talk more about that during this conference. So this was a quote that the World Economic Forum ran with that I said somewhat offhandedly, but you can probably toss out your human resources manual and just rewrite it as be kind. So here's the thing. We have all this data, and I'm just touching on tiny little bits of it here, that shows kindness in all the areas of our life is so critical to our health and well-being and the well-being of the people that we love all around us. So all we have to do is follow this framework. Easy peasy, right? So obviously, kindness is really hard. It's a really hard practice. It's a goal to be striving towards. And it's something that's constantly, every day, we're working to try to figure out a little more. And I think right now, between family strife, political divisions, tensions everywhere, social injustice, war, we're all feeling the unkindness that's out there. And so let's talk a little bit more about where we're at with that. So unfortunately, this has big health implications for us. So this graph here is, let me see if I can get the pointer working. I tried to highlight. So this is a graph. This one is from 2021. This graph has more or less looked like this for decades. So in the United States, we pay a fortune for medical care. Like, we pay way more than any other wealthy nation. And unfortunately, we get a lot less for our money. It turns out that our health outcomes are way worse than other wealthy nations. So that means kids who are born in the United States don't live as long, full, healthy lives as they potentially could for kids that are born in other wealthy countries. And this also means for people who are born wealthy, they are even of good means, they don't live as long as other people who are born with good means. And there's also another piece of kindness that's a part of this that I want to discuss. And that's fairness. Feeling that you're treated fairly in all the tiny moments of your life matters deeply to our health. And we know that part of the reason on that graph in the US we don't do so great is because a lot of people don't feel they're being treated fairly. So as upstanders in this room, one of the things that we can do that's kind is to be sure that we're paying attention when it feels someone's being unfair, because here's the irony. People do better in more equitable societies, and that's across the board. So the more fair we can make it for people, the better we all do. All boats will rise with the tide. And we also know that emotional health matters tremendously, and it hasn't been so. It's also one of the other elephants in the room here. Half of us will experience a significant health challenge or a mental health challenge over our lifetimes, with anxiety and depression being the most common. And that means if it's not us, it will be somebody that we love. Depression is the #1 cause of disability in the world, and yet it receives about 1% of global aid. It's considered a more significant health challenge than things like heart disease, cancer, obesity. And then, of course, we had the pandemic. So since 2020 and all the challenges that have arisen over the last 2 years, it feels like 100. When I say 2, it's still, I can't quite wrap my mind around it. I do want to just take a second, though, because I think something that we're going to be talking about along the themes of resilience is post-traumatic growth. So maybe just take a second, because we obviously can't control what happens to us, but we can control what we feel we learn from that. So maybe just take a second and think about something you learned about yourself during the last 2 years, like maybe a strength you had that you didn't know about, that you would like to just acknowledge. So just take a second to do that. So I want to just ask you, what would it take to choose kindness in your lives? And what would help? I want to give you just a couple practical tools in our last 30 seconds. Number 1, we've talked about this in different contexts at WAHASU, and it will come up again. Studies show inevitably, it's not about if you have a character of kindness, it's about if you're in a rush. So we tend not to be as kind, we're in a rush. And so make sure that when you can, try to take a pause. And this includes everything from taking a couple deep breaths to, if you can, take a vacation, take a break. You're taking a pause by being here and thinking about your own happiness and well-being and how you can spread it. So thank you. And with that, let's all just take a deep inhale, exhale together. And I can encourage you throughout the day to do that. And also studies have shown that reduces bias if you can take a pause even before going into a difficult conversation. As a physician, that's something I think about a lot. And I just want to take a couple minutes to think about, what would our world look like? Imagine our world if we all had this goal in mind. Maybe it's the kind of place where every child would feel safe, supported, loved, where every human being felt that they had something to offer despite whatever challenges they might face. And maybe it's the kind of place where we all feel a part of a community, something like Wahasu, where we feel connected to one another. And I know that that's a big part of what we're doing here today. And I just want to say, I know, because I've been so fortunate to be studying kindness, that every little act of kindness, you never know the effect that it might have on someone. And it might be delivered right at the right moment when they need it. And you will never know that, but just know that your small acts of kindness really make a difference in the happiness and health of the people around you. So thank you.